Hi.
Oh, provide you some privacy. How are you doing today?
I'm doing great. How are you?
I'm so good. Thank you for asking.
You're welcome.
I'm needing to get a head-to-toe assessment for you today. Is that okay?
Yeah, that's fine.
Awesome. I'm going to go ahead and have you confirm your name and date of birth for me.
Jojo Estorpe, September the 3rd, 2004.
Awesome. And before we get started for your head-to-toe assessment, which is basically just an assessment from your head to your toes, just some basic information to make sure you don't have any abnormalities. Make sure everything's okay. Awesome. I do have to ask you a few other questions before you get started. Do you know where you're at today?
Yes.
Where is
National Park.
Awesome. Awesome. And you know what day of the week it is?
Yes, Wednesday.
Awesome. Okay. Do you have any allergies I should be worried about? Latex, iodine? Awesome. And I am going to go and start writing this up. I'll ask you these last few questions. And have you been noticing any discomfort, any pain, nausea? No. Awesome. And before we get started, do you need to use the restroom at all? Awesome. And do you know your most recent bowel movement and when you used the restroom?
Yesterday.
Awesome. So good movement. Nothing out of the crazy. And below that questions, I am going to go ahead and lower this part. I assess that your chest is rising and falling at a good rate. I will need to check your eyes first and then your mouth. Check your eyes first. Awesome. Looks good. Pupils are reacting to light. They're equal around. I'd say it's between the 3 and 4 gauge. And I am going to do an accommodation test for fun. I'm going to have you look at my finger again. And then I'm going to have you look past. Then I'm going to have you look at it one more time. So when you look at it, your eyes contract and then look away from me. And then that's when they dilate, when you look at the distance. Awesome. And then I'm going to look one last time in your mouth. You open your mouth. Say, awesome. Everything looks good. Good color. Integrity. Everything's intact. No lesions. Everything looks good there. Next, I will need to check your heart sounds and your lungs. Do you mind going ahead and taking your shirt off for me?
Yes. I don't mind.
Awesome. Yeah, I'm going to have you face this way.
Are y'all staying in here?
Awesome. So I'm going to start at your aortic, which is the second intercostal down on the right side, and it borders your clavicle. Inhale from me. Awesome. Exhale. Awesome. Then we're going to move over to your pulmonic, which is also second intercostal down, and it also borders your clavicle. Inhale for me. Awesome. Exhale. Then we're going to move down to your tricuspid, which is the fourth intercostal down on your left side. We're going to move to your mitral, and that one is your fifth intercostal down, where it borders it midlines the clavicle. And have you inhale for me. Take a nice deep breath and then exhale. Awesome. So everything sounds good there. The sounds are, rhythm is good, good strength, nice volume, they're deep and steady. Also, you don't have any abnormal heartbeats or anything. Extra beats. Nope. None of it, all the goods. And then next we're going to check your lungs. Like I said, your chest was falling at a nice rate, so there's nothing too worried about there. Just start on this side. Nice deep breaths for me when I check. And I'm making sure to go between the ribs, or the intercostals, excuse me. your back. Like I said, everything sounded good there. So on the side, take a deep breath, making sure to miss the scapula. Gave you the chills, didn't it? Well, everything sounds good there. All good steady breaths. Well, we're just going to go ahead and move on to the next. Have you lay back on your back again. This time we're going to go move it down for abdomen. We're going to check for any sounds that we've been hearing. And then I will check for any abrasions. Okay, some pressure on your abrasions. Sorry, excuse me, masses. Thank you. Any masses on the stomach? First, we're going to listen just to make sure everything is good. We're going to start with your right lower quadrant, moving up and going clockwise. So like I said, we start with the right lower and right upper, moving over to the left upper, and down to the left lower. Awesome, and everything sounds normal. Gurgling. No abnormalities there. Your stomach is in proportion to your body as well. You get a little assessment going there. So now into the pressure part of that, I am going to lay you a little bit flatter. Awesome. So I'm going to start the same way. Right lower, working my way up, and going clockwise. You will feel a little bit of pressure. Shouldn't hurt at all though. Okay. Awesome. Start at the right lower. Awesome. Right upper. Left upper. And left lower. Awesome. No masses that we should be worried about.
Okay,
Everything's all good. Now I'm going to move on to your extremities, starting with your brachial and radial pulses. Checking to make sure that those are okay. Thank you. Laying the arms out to the side. Awesome. Both are equal in strength and both strong, clear, and distinct. Same thing with your radial pulses. Now, if you don't mind, just letting me see your hands real quick. We're gonna enact a strength test. So I'm gonna cross my hands, and all I'm gonna need you to squeeze my fingers. Quick. Awesome. Equal in strength. Now, if you'll just let me see your hands. Test them both with a Turner test. Make sure that you are hydrated. Awesome. Skin fell at a normal rate. Now we're going to check your nails, both sides. Awesome. Capillary refill was within 30 seconds. Everything is good there. So now we're going to move on to your lower extremities. Okay? So I am going to put your awesome. Awesome. It'll be a little bit lower, but that's okay. Do you mind taking your socks off for me real quick?
Yeah.
I'm going to go ahead and put some gloves on real quick. So basically the same thing we assessed with your hands. We're going to check for your dorsalis. Your dorsalis pulse. And then we're going to check for capillary refill, and we're going to check your dorsal and plantar flexion strength. Okay. Awesome. Awesome. So the first thing we check for is dorsalis. Awesome. Good in strength. Equal. We check these. So capillary refill within 3 seconds. Now I'm going to have you push up on my hands with just your feet. Awesome. Good. Equal strength. Push down with the gas pedal. Awesome. All good strength. And I believe that concludes the head to toe assessment. Was there anything else I could get for you today?
No, ma'am.
Awesome. Well, I am gonna put your rails back up, and I'm gonna lower your bed back down as low as I can get it. Would you like to still be sitting on it?
Yeah, that's fine.
Awesome, is that good?
Yes.
Awesome, put your crawl light in reach. If you do need anything, please make sure to grab that light. And I will get all your assessments back to the appropriate person.
Thank you.
Hi, I'm Bailey. I'm going to be your nurse assessing you today. Can you tell me your name and your date of birth?
Kendall Ardrey, 9/10/1996.
Any complaints today?
No, just here for my checkup.
Okay. I'm going to be assessing your abdomen. Okay. We're going to pull your shirt up and your pants down a little. Okay. I'm going to take a listen with my stethoscope. We're going to listen to all 4 quadrants. All 4 quadrants are active. Are you having any pain?
No.
I'm going to palpate your stomach in all 4 and tell me if it hurts. Oh, no. Okay. I'm going to check your liver here. See if we can check your pancreas. Okay. Okay. We're just going to tap here. Okay, everything sounds normal. Have you had any change in appetite? Any change in bowel movements?
No.
Weight gain or loss?
No.
No complaints?